Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Ondansetron Injection, exploring the various aspects of ondansetron, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Ondansetron Injection. Ondansetron injection is primarily used to prevent nausea and vomiting caused by chemotherapy, radiation therapy, and surgery. It is a selective serotonin 5-HT3 receptor antagonist, which blocks the action of serotonin, a natural substance that may cause nausea and vomiting. Next, dosage of Ondansetron Injection. The dosage of Ondansetron injection varies depending on the purpose and the patient's age and weight. For chemotherapy-induced nausea and vomiting, the recommended adult dose is 8 mg administered as an intravenous infusion over 15 minutes, beginning 30 minutes before the start of chemotherapy. This can be followed by 2 more 8 mg doses at 4-hour intervals. For postoperative nausea and vomiting, a single dose of 4 mg is administered immediately before the induction of anesthesia. This information should not be a substitute for professional medical advice. Always consult a doctor before using Ondansetron injection. Next, mechanism of action of Ondansetron injection. Ondansetron works by selectively inhibiting serotonin 5-HT3 receptors. These receptors are located on the nerve terminals of the vagus nerve and in the chemoreceptor trigger zone of the central nervous system. By blocking these receptors, ondansetron prevents serotonin from binding to them, thereby inhibiting the signal that causes nausea and vomiting. Next, side effects of ondansetron injection. Common side effects include headache, dizziness, and constipation. Some patients may experience more serious side effects, such as severe allergic reactions, changes in heart rhythm, and low blood pressure. It is important to monitor patients for signs of these adverse reactions, particularly during the initial administration. Next, important advice for using ondansetron injection. Always follow the prescribed dosage and administration instructions provided by a healthcare professional. Inform the healthcare provider of any known allergies, especially to ondansetron or other 5-HT3 receptor antagonists. Notify the healthcare provider of all medications currently being taken, as ondansetron can interact with other drugs, particularly those affecting heart rhythm. Pregnant or breastfeeding women should use ondansetron with caution and only if clearly needed, as its safety in these populations has not been fully established. Monitor for side effects, and seek immediate medical attention if serious adverse reactions occur. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using ondansetron injection. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.